Prostate cancer, the symptoms you need to know. Prostate cancer is one of the most common types of cancer in men, affecting hundreds of thousands of men worldwide every year. In the United States alone, approximately 300,000 new cases are diagnosed annually, and in Australia, around 20,000 cases occur each year, with 3,000 related deaths. Prostate cancer's silent nature, especially in its early stages, means many men are unaware they have it until it's too late. In today's video, we will cover the warning signs you should look out for, as well as the significance of early detection, screening, and proper medical care. 1. Frequent urination. One of the most common early warning signs of prostate cancer is frequent urination, particularly during the night, a condition known as nocturia. This happens when the prostate enlarges and starts pressing on the bladder. As the prostate grows, it constricts the urethra, making it more difficult for urine to pass through. This increased pressure causes the bladder to empty more frequently, often resulting in the sensation of needing to urinate, even if only small amounts of urine are released. For many men, frequent nighttime urination can severely disrupt their sleep, leading to fatigue and a decreased quality of life. If you find yourself waking up multiple times at night to urinate, it's important to consult with a healthcare professional to rule out prostate issues. 2. Hesitancy. When urinating, hesitancy refers to the delay in starting urination, despite the feeling of needing to go. This issue can be frustrating, as the flow may be slow to start or intermittently stop. David initially ignored these symptoms until he found himself struggling to fully empty his bladder. After further testing, we discovered that his prostate was enlarged and partially blocking his urethra. He had a weakened stream that stopped and started, which led to discomfort and frustration. If you experience similar issues with starting urination, or if your urine stream is weaker than usual, it could signal a blockage or another prostate issue that should be addressed promptly. 3. Burning or stinging sensations. While a burning or stinging sensation during urination isn't always linked to prostate cancer, it's a symptom that should never be ignored. This could be a sign of a urinary tract infection, UTI, which is relatively common in men but less frequent due to their longer urethras. However, when these symptoms are persistent or accompanied by other urinary issues, they might suggest something more serious, such as prostate cancer or inflammation in the prostate. In cases where prostate cancer grows in proximity to the urethra, irritation or infection-like symptoms can manifest. It's important to see a doctor if this sensation occurs, particularly if there's no clear cause, as infections and other underlying health issues may require treatment. 4. Blood in urine or semen. Blood in urine, hematuria, or semen, hematospermia, is one of the most alarming symptoms associated with prostate cancer. While the presence of blood in urine or semen could also be caused by other factors such as trauma, infection, or kidney stones, it's essential to have this symptom checked by a doctor immediately. Blood may appear in the urine or semen when a tumor is growing in or near the prostate, which can cause bleeding in the urinary tract or reproductive system. It's crucial not to dismiss this symptom, as early detection of cancer can significantly improve treatment outcomes. 5. Erectile dysfunction. Erectile dysfunction, ED, is another warning sign that may be linked to prostate cancer, especially if it arises suddenly or without any obvious cause. Prostate cancer can affect the nerves responsible for erectile function, as these nerves are located near the prostate. If cancer grows in or near these nerves, it can interfere with their ability to function properly, leading to difficulties in achieving or maintaining an erection. Additionally, other lifestyle factors such as high blood pressure, diabetes, or high cholesterol can contribute to ED. Therefore, it's important to distinguish between ED caused by prostate cancer or other underlying health issues. If ED develops unexpectedly, particularly if it's accompanied by other urinary or sexual symptoms, seeking medical advice is crucial. 6. Painful ejaculation. Pain during or after ejaculation can be a significant symptom of prostate health issues, including cancer. Brian, a patient of mine, reported experiencing sharp pain during ejaculation, which he initially dismissed as stress-related. However, after further testing, We discovered that the cause was inflammation around his prostate. If you experience painful ejaculation alongside other symptoms like pelvic pain or urinary difficulties, it's important to seek medical advice promptly. This symptom could be an early warning sign of prostate cancer or another serious issue. 7. Bone pain. One of the hallmarks of advanced prostate cancer is bone pain, particularly in the spine, pelvis, or hips. Prostate cancer has a tendency to spread, metastasize, to the bones in its later stages, where it can cause persistent and often severe pain. This pain may be more noticeable in the back, legs, or hips, and may worsen over time. Unlike typical back pain, which can be associated with muscle strain or injury, cancer-related bone pain often does not improve with rest or over-the-counter pain medication. It's important to seek medical attention if you experience unexplained or persistent bone pain, particularly if it's accompanied by other. 8. Unexplained weight loss. Sudden, unintended weight loss is another symptom of advanced prostate cancer. As the cancer progresses and spreads, it can affect the body's metabolism, leading to the breakdown of muscle tissue and a loss of fat. Men with advanced prostate cancer may notice a significant drop in weight over the course of a few months, often without changes in diet or exercise. This weight loss is often accompanied by a general feeling of weakness, fatigue, or malaise. If you experience unexplained weight loss, especially when coupled with other symptoms like bone pain or fatigue, it's crucial to seek medical evaluation to determine the underlying cause. 9. Lymph node swelling. If prostate cancer spreads to the lymph nodes, you may notice swelling in the lymph nodes around the pelvic region, groin, or armpits. These swollen lumps are often painless and may be small at first, but over time, they can grow larger as the cancer spreads. Swelling in the lymph nodes is an indication that cancer has spread beyond the prostate, which can complicate treatment options and affect prognosis. If you notice any lumps or swelling in these areas, particularly if they persist or grow in size, it's important to consult with a healthcare provider for further investigation. 10. Overall feeling of being unwell. Finally, prostate cancer may lead to a general sense of being unwell. This could include fatigue, weakness, a lack of energy, or a general feeling of discomfort. As cancer progresses, it can cause systemic symptoms such as fever, night sweats, and changes in appetite. These nonspecific symptoms often develop in the later stages of the disease and can be mistaken for other health problems, such as chronic stress or viral infections. However, if these symptoms are persistent or accompanied by other warning signs, they may indicate that prostate cancer has progressed and prompt medical evaluation is recommended. The importance of early detection. While prostate cancer often grows slowly and may not show noticeable symptoms in its early stages, regular screenings are essential for early detection. The PSA, prostate-specific antigen, test is a simple blood test that can detect elevated levels of PSA, a protein produced by the prostate. An elevated PSA level can be a warning sign of prostate cancer, though it's not conclusive. It's important to understand that a high PSA level does not automatically mean cancer, as conditions like benign prostatic hyperplasia, BPH, or prostatitis can also cause elevated PSA levels. However, the PSA test is a valuable tool for detecting potential issues early, allowing for more effective treatment options. Combining PSA testing with a digital rectal exam, DRE, can provide a more comprehensive evaluation of prostate health, helping to detect potential cancers before symptoms become severe. Early detection greatly improves the chances of successful treatment, so regular screening, especially for men over the age of 50 or those with a family history of prostate cancer, is highly recommended. As a healthcare professional, I've seen firsthand how prostate cancer affects not only the individuals diagnosed, but also their families. One case that stands out involved a patient who had been experiencing urinary issues, but had brushed it off as a normal part of aging. He came in for a routine checkup, and his PSA levels were high. Further tests revealed early-stage prostate cancer. Luckily, because it was caught early, his treatment was successful, and he's now in remission. This case serves as a reminder that no symptom should be dismissed, and early detection can save lives. Another patient I remember had no symptoms at all, but had a routine PSA test done. His results indicated potential prostate cancer, which led to early treatment. His case highlights the importance of taking preventive measures and not waiting for symptoms to show up. It's easy to ignore our health when we feel fine, but regular checkups can make all the difference. Prostate cancer is a silent disease that can progress without noticeable symptoms, so taking steps toward prevention through regular screenings is crucial. Prostate cancer is a serious health issue for men, but it doesn't have to be a death sentence. Many cases are treatable, especially when caught early. The key takeaway is that men should not wait for symptoms to show up. Regular screenings, especially the PSA test, can catch potential issues early, allowing for timely intervention. If you notice any of the symptoms mentioned, or if you're over 50, I strongly encourage you to speak with your health care provider about getting tested. Don't wait until it's too late. Remember, taking care of your prostate health is taking care of your future. Lastly, I urge you to pay attention to your body. Even if you think something is minor, it's better to get it checked out than to ignore it. Share this video with friends and family to help spread awareness, and make sure to take charge of your health.